Golden Opportunities is paid for by Elder Productions.
Hello, I'm Lori Steiner. Welcome to Golden Opportunities.
Today, we'll preview a pet project where volunteers raise puppies to be guiding eyes for the blind. Then, we'll share how to make grandparents grin. Time to sign up for Medicare? We have questions you should ask and things you need to consider. Plus, we'll prescribe a healthy dose of medical news you can use. And is it short-sighted not to buy long-term care insurance? We'll look into it.
It's time to get GOing, so pull up a chair and join us at our kitchen table for Golden Opportunities. Today we have a real case of puppy love. Meet Gaston, who is being raised for a very special job, to be a service dog for Guiding Eyes for the Blind. Gail Papish is here to tell us about this amazing organization, and Phil and Susie Melendez, Gaston's temporary parent, are here to share their story. Gail, Phil, and Susie are all volunteer puppy raisers. Welcome to the show, and welcome to Gaston. So Gail, tell us how the process works from puppy to service dog.
Well, Guiding Eyes for the Blind has over 50 families presently raising dogs for this special purpose, but we're always looking for more puppy raisers. And it starts with a simple phone call to Teresa, our intake person. There's an online application, and then after that you'll be invited to watch puppy class. You'll attend a pre-placement and orientation class, and then you're put on a list to get a pup.
Oh boy, so how old are the puppies when they are placed?
When they arrive, they're between 2 and 3 months old. We raise Labrador Retrievers and German Shepherds. You can specify whether you like a male or a female dog. But when the pups arrive, that's when the fun begins. There's nothing like puppy breath to get you going.
And that love. So, Phil, you're retired. What made you decide that this was something you wanted to take on?
My wife really. She saw the ad on the back of the sports page, and a week later I called the organization.
Okay.
We love dogs, and certainly enjoyed the companionship of puppies growing up in our own homes, and then when we raised our children. But this is different, Lori. The training is unique because these dogs are going to serve the very special individuals in the future when they're guide dogs. Phil does the training in our home, does a great job.
Yeah.
Yes, Augusto knows that as well. Yeah. But as much effort and time as is involved, we feel that it's a wonderful opportunity to give back. And also, we consider it a labor of love.
Oh, of course. Doggies give love. So, Phil, what's the difference between training a puppy for the service dog and training a puppy just to be a member of the household?
Well, since learning to train a puppy as a puppy raiser, I would raise all my puppies this way. And the weekly classes are very informative. In the training, house manners are very important, like not being on furniture and not eating from the table. And
so you're giving them the basics so that they can get that really specialized training later on, right?
yes.
Okay. And Susie, as you said, you're both dog lovers.
Yes.
So how do you give up a puppy? I would have such trouble after a period of time.
Well, Lori, it's heartbreaking. You know, we cry a lot. You know, these are very special dogs, and the opportunity to raise them is heartwarming, or excuse me, heartbreaking, but also heartwarming. We receive a lot of support from the organization Guiding Eyes for the Blind, and also from our fellow puppy raisers.
So what happens at the end of the line?
Well, we choose to return our puppies to New York when they're ready to be tested, and if they pass, they move into their formal guide dog training, harness training. What makes it all so worthwhile is at the end when we see our puppy graduate in harness with his or her handler. then the heartbreaking experience becomes a heartwarming experience. And it's a wonderful, wonderful opportunity. But what we do is when we return our beloved puppies, we turn right around and get another one.
Oh, that's great.
Yeah, that's what we do. That helps a great deal.
Oh.
Yeah.
Well, doggone it.
Yeah.
I wish we had more time to talk, but this is a great program.
Yeah.
If you'd like to be a part of it or support their efforts, use the information that's coming up next. My thanks to Gail, Phil, Susie, and of course Gaston for joining us today.
Thank you for having us.
All right, thank you. Okay.
To find out more, call Guiding Eyes for the Blind at 440-382-9848 or log on to www.guidingeyes.org. Next, grandkids aren't the only things that make seniors smile. But first, Happy Grandparents' Day! Officially proclaimed in August 1978, Marion McQuaid is credited as the founder of this holiday. And it's no surprise that Marion was a grandparent herself. Can you guess how many grandchildren she had to honor her? We'll count the branches on her family tree when we return.
Hilltop Village Apartments is retirement living at its best. Residents enjoy a wide variety of activities and living services with all large first-floor apartments, private screened-in patios with beautiful park views, daily dining room meals, free laundry facilities, 24-hour staff, and so much more. Enjoy safe, comfortable independence at a very affordable price. Call today for a tour and learn how you can get your first month's rent free. Hilltop Village Apartments, retirement living at its best.
Marion McQuaid's goal for Grandparents' Day was to focus on the lonely elderly and to encourage children to discover the interesting lives of their grandparents. Who did she share her life stories with? Her 15 children, 43 grandchildren, and 15 great-grandchildren.
Today is Grandparents' Day, and it's no secret that grandchildren can easily bring a grin to any grandma or grandpa. But sometimes that smile is suffering from issues or ailments. Today, dentist Steve Marsh is here with stories of smiles restored for a group of grandparents.
Right. Well, I guess we're going from canines to canines.
That's true.
It's a joke I couldn't resist, but it's a pleasure to be here to talk as grandparents.
Okay, yes, I'm a grandparent, and that's my granddaughter, Anna. And you're a grandparent.
Yeah, I am, and that's our daughter Stephanie and our grandson Owen, who's 3.5, and you can see those beautiful smiles. Today we
you raised them right, huh?
We raised them right, and today we all want our smiles to look good. You know, more than ever, Lori, people have found out that, you know, the mouth is the only way we get nutrition. We sort of take it for granted. So if our teeth aren't functioning well, if you have pain, that sort of thing, you're not going to chew your food as well. If you're missing teeth, you really don't get the nutrition. And we have patients as they get older who have to limit what they're eating because of digestive problems. So it's important for function, and it's also important for cosmetics as well. But remember that nutrition is all entering through our mouth.
Right, and we want, the health of our smiles is so important a lot because of that nutrition. But grandparents want their smiles to really look good too. So, and that can be really hard with, as you've identified, there could be fractures or breaks or all kinds of decay.
And you know, today we always, they say 70's the new 50 or 60's the 40, whatever. And we all want to look better, whether it's the clothes we wear, the hair we have. And so teeth are important from how we look. We may be dating, there may be a divorce, there may be death in the family. You want to go out, you want to work longer. And your smile and your teeth are how you present. So we thought we would look at some grandparents who came to us for different needs. It's very interesting, a wonderful woman, and she actually ended up referring her grandkids to us. She said over the years her teeth started to break down a lot, they cracked. She was actually a Golden Opportunities viewer, so you do a nice service for the community. And she was unhappy with her smile. She also started to break teeth. You can even see her left front tooth. After 60, 70 years in the mouth, teeth start to break apart, especially ones. So she said, I want a big white smile. This is what we call a retracted view in dentistry. We use porcelain veneers in the front. In the back where she had some broken teeth, we used some crowns and bridges. Today, all porcelain, no metal, to give her that smile. And she said she was so proud of it. Now she wanted her grandkids to take care of their teeth. So people do it for different reasons. This woman has always been bothered by her smile, and her daughter's a professor and said, my mom has always taken care of all of us. And we have a family reunion, and there was about 100 people coming, and she said, I'd like to do my teeth. So that's actually porcelain bridge work in the front, Lori. Again, all porcelain. She didn't want anything removable, and she was in her 80s. She said, I want to enjoy my food. I want to have a beautiful smile. She subsequently came back from that family reunion and said, I was the star of the reunion. People said, first, I look different. I love your smile. And it was a wonderful feeling for us as well. This woman came to me because her grandchild said to her, Grandma, your teeth look dirty and old. Why do they look so dark?
Oh, dear.
So that's what brought her in. It wasn't her husband, it wasn't her kids, it was her grandchild. And she came in and we did porcelain veneers. The teeth had twisted a lot. We reshaped them. We did the lowers. And again, we did this in stages. We wanted to give her that upper big, beautiful, bright smile. And lastly, a woman whose daughter was getting married. She had old work years ago. She ended up losing a tooth. Those are old crowns that she had had. She wanted permanent teeth, and she wanted to go to her daughter's wedding with a big, beautiful white smile. So she came to us, and we used some bridge work and some porcelain work and gave her this really fun smile. And she said she loved the wedding, and for the first time in her life, she wasn't afraid to smile. And how important is that for a wonderful occasion as a wedding?
Right. Grandparents need to look their best. When you have a grand old time with your grandchildren, you don't want to have to hide your smile. Follow Steve's advice for caring for your teeth. Need more help? Give Steve a call. The number's next.
See what Dr. Stephen Marsh can do for your smile by calling 440-461-1003 or visit www.clevelandsmiles.com. Next, understanding your Medicare options. Looking for places to go, things to do? Welcome to our community calendar. Walk this way to the 11th Annual Cleveland Senior Walk. On September 23rd at Mall C, join other seniors who are strutting their stuff. Registration and health screenings take place at 8:45 a.m., and then this free 1 or 2 mile fun walk steps off at 10. To find more information, including how to get a free t-shirt, call 216-664-2833 or log on to www.cleveland-oh.gov/aging.
If you're turning 65, that means it's time to enroll in Medicare. However, enrollment isn't always easy. Here to ease us into the deadlines and details is Matt Tucker. Matt is the president of TrueBridge, a company that specializes in Medicare education. Sounds like a very needed service.
Very, very needed.
So let's talk about deadlines and turning 65. So it can be more expensive if you don't pay attention to what's going on with Medicare and what you have to do.
No, absolutely it can. I mean, the good news about it is that Medicare, generally, you're automatically enrolled in A and B 3 months before turning 65, or if you've been on disability for 24 months. So a lot of people are automatically enrolled. The deadlines that they're concerned about are making sure during that initial enrollment period that they choose the right Medicare or prescription plan that works for them, that meets all their needs. You know, one penalty or concern that people have is around prescription drug coverage. There are penalties that come into play if you don't choose a plan within the required time frame.
Okay, so we're showing now on screen some of the time deadlines there. So tell us about those.
Sure. So from the time you, from 3 months prior to turning 65, the month of your birthday, and then 3 months after, you have the ability to enroll in a Medicare plan, a Medicare Advantage or a Medicare Part D plan, or you have guaranteed acceptance in a Medicare supplement plan. So it really depends on, as you can tell, there's a lot of options for people. This is their window to really get into the Medicare plan and choose the right coverage for them.
Okay. Well, you talked about A and B and C and D. That's confusing in and of itself, besides right around your birthday deadline. So tell us what all of those mean.
Sure. Well, Medicare Part A is generally around inpatient hospitalization. It does include some hospice or home health care coverage. Medicare Part B is really for outpatient services like doctor visits, x-rays, lab work, durable medical equipment. So those are the first
That's
two.
your main health insurance.
Yes.
So, and on that screen it said you have to have A and B before you can get C, and you have to have A or B before you can get D. So let's talk about C and D.
Okay. So Medicare Part C, most people would know that as a Medicare Advantage plan, and it could be an HMO, PPO, fee-for-service plan. You have to have A and B, and that's basically represented by private insurance companies who are managing your health care. Medicare Part D is specific to the prescription drug benefit. And some Medicare Part C plans can have D coverage in them, and you can also just buy a prescription drug plan by itself.
Okay. So if you've got all these plans going, it sounds like it could get expensive. Is there some help for that?
There is. I mean, obviously the first thing is making sure you do a needs analysis and find the best plan that fits your situation. But let's say you had some income issues. Obviously when we retire, our incomes are generally lower. If you meet certain income requirements, you may get assistance from Medicaid, or you may qualify for low-income subsidy, which helps with your prescription copays or monthly expense.
Okay. It sounds like, though, you've got a lot of options and you really need some help.
It would be highly recommended. It's very confusing. There's a lot of plan options. Like I said, you have Medicare supplements, Medicare Advantage plans, Part D plans, and then there's many options within those categories. So what we try to do at TrueBridge is just do a needs analysis and walk people through what fits their situation and what's important to them.
Perfect. So now is the time to investigate your options. To learn more, use the information that's coming up next. My thanks to Matt Tucker for joining us today.
Thank you.
For more information, call TrueBridge at 855-663-5593 or click to www.truebridgeit.com. Next, a healthy discussion. It's time to get up and go, an exercise minute on golden opportunities.
Hey everybody, it's Mike Carbon from Breakout Fitness, and today we're going to show you how to work the biceps and the back muscles by doing a seated row exercise utilizing our exercise band, okay? Ready to go?
Let's do
it.
this.
So we're going to start seated in a chair. We want our heels out in front of us with our toes pointed towards the ceiling. We're going to place the band around the arch of the foot. Once we're there, we can go ahead and crisscross the handles just to make sure the band stays in place. Make sure you maintain a good posture. Pull your fists into your chest and squeeze your shoulder blades. Okay, exhale with exertion and inhale as your body rests. So squeeze the shoulder blades, fists out in front of you, 12 to 15. How you feeling?
Oh, it feels great.
Not too bad. All right, everybody, 2 to 3 sets, and now it's your turn to get up and go.
For your copy of the exercise booklet, send $1 for postage to Golden Opportunities, 6105 Parkland Boulevard, Suite 140, Mayfield Heights, Ohio, 44124.
Car keys. They don't just represent transportation from point A to point B, they represent freedom. But we know all too well that some seniors can't drive safely, and the keys should be put on the table. Dr. James Campbell is here to drive home ways to keep seniors safe. Dr. Campbell is the director of the Senior Health Outpatient Center at Metro Health. Welcome back to the show.
Thank you.
So is there a certain age that we should just be cut off from driving?
There's definitely no age that indicates when your driving should be looked at and reevaluated. What's important is to really evaluate the kind of conditions that affect your ability to drive safely. Mm-hmm. It's important to make sure you've had a good vision assessment, good hearing assessment. Patients who are having trouble with falling are the kind of people who may be having trouble with driving.
Oh.
As well as making sure that you're having a good cognitive assessment to see if there's any evidence of dementia, in addition to what is your driving record and what has been your driving success or lack thereof.
Okay, so just because you're older doesn't mean you have to stop. It could be a health issue or something. A lot of times it sounds like dementia is the problem with driving.
Dementia can be a huge problem with driving, partially because what happens, for example, with sort of some of the slowing of the reflexes, or maybe your joints are a little arthritic, and so that you're not quite as quick as you used to be. Those kind of conditions, what the older driver does is they actually correct for those. And so they will drive a little bit slower, or they'll stop driving after dark, or they'll stop driving on the highway. because their decision-making capacity is intact about what's a safe way to drive.
Okay.
If you're having issues with cognition or dementia or Alzheimer's, you may not be able to make the right decisions about whether or not you're safe to drive.
Okay, so even if dementia is the issue, it doesn't make it easy to talk to your parents, especially if they don't recognize that something's going on.
It's very, very difficult. The driving is so big for individuals in the United States, particularly, you know, it's part of your identity. It was your rite of passage when you were 16, and to have somebody talk about taking that away, we strongly encourage people to do this with the help of a physician. A geriatrician is often very helpful because you don't want the family to be the bad guy.
Right.
You don't want to be the person, well, I took away Dad's keys. It's much better to say, well, Dr. Campbell took away Dad's keys.
So what do you say to patients?
Well, I mean, you really do. You sort of talk to patients about who they are, who they've been, what they're proud of, and they start to talk about, well, I was a good father, I was a good husband, I was a good worker, and you know, and you sort of, well, you're a good driver. Oh, I was a great driver. And you sort of say, well, you wouldn't want to have that whole lifetime of good behavior and track record ruined by an accident.
Okay.
But you also have to go into that conversation having done some background work with the family about how are you going to make it so that that doesn't make that person isolated and at risk for depression. So how are we going to arrange for them to have transportation, you know?
Is it going to be the family, or are there other programs?
There's lots of resources. Senior Transportation Resources, who was on the show a little while back. You know, in some communities, like in our community in Old Brooklyn, Senior Citizen Resources, there's paratransit through the RTA. You know, there's a lot of resources out there, but you have to know how to access them.
All right, this sounds like great information for our kids out there who are worrying about their parents. So my thanks to Dr. Campbell for mapping out the keys to keeping seniors safe, including when to put the car in park. Follow his directions to keep your loved ones and the others out on the road out of harm's way.
To learn more, call Metro Health at 216-778-7800 or visit their website, www.metrohealth.org. Next, should you have long-term care insurance?
Here at Metro Health, you know you matter when it matters most. Here, we are the city's best at preparing for the world's worst. Here, we are the only verified burn center in Ohio for adults and children. Here, you'll find exceptional clinicians with extraordinary hearts. So the work we do here at Metro Health makes an impact here, out here, and right here. Metro Health, we're here for you, for all of you.
Long-term care, whether in assisted living, a nursing home, or at home, is expensive. How to pay for such care is something we've discussed on this program many times. Long-term care insurance is one solution. Should you buy it? Here to discuss this complicated issue is my law partner, Michael Solomon.
Hi, Lori.
So what exactly do you mean by long-term care costs?
Well, long-term care is helping people with certain basic activities that they maybe can't handle because of a chronic illness or a disability, like, for example, bathing or dressing or eating, or they might need skilled nursing care or some sort of therapist. So, those add up, those are expenses, and your regular health insurance or Medicare don't necessarily cover that, or they only cover it for a short period of time. So, that can add up. Genworth, for example, big financial companies, estimated that a long-term care facility averages around $91,000 a year. And for people who want home health care, who are taking, have care at home round the clock, that could go up to $170,000 a year. So it's a lot of money.
Yeah, that's really a lot of money. So what should someone do to make sure they can pay for that kind of long-term care if it's needed?
Well, there are really only three choices. Number one, you either pay for it yourself out of your savings. Number two, you let the government pay for it, Medicaid or VA benefits. We've talked about that, but basically you've got to get rid of your assets to qualify for that, or you buy long-term care insurance.
Okay, well, we need to talk about all of that, but first let's talk about the first two choices, out-of-pocket and then government.
Okay, so as I mentioned, long-term care costs are expensive, and the 2011 census, for example, said that people between the ages 65 and 69, their median net worth was a house worth around $150,000 and $44,000 of other assets. That means half above and half below. So the people in that bottom 50%, maybe most of them just have Social Security income. They're not going to want to spend another $3,000 or $4,000 a year for long-term care coverage.
Can't afford that.
That's right. They're just going to say, look, I'll use up my assets, then I'll qualify for the government program. Sometimes they do some of the planning we've talked about on the show where they can save some money for their children, but basically they use up their assets. The other group of people, they have a substantial amount of assets. They maybe have a private pension plus their Social Security, and they try to self-fund it. Now, it's been estimated that you need around $1 million of assets plus your pension and Social Security to incur that cost. That's 5% of Americans have that. So you have 5% can self-fund, the other bottom 50% have to use the government, and that leaves the middle group.
Okay, so we're not in the top 5%, but not in the bottom 50%. So is that the area, that's the time to consider long-term care insurance?
Well, it's certainly time to consider it. The trouble is there's no answer. I can't say, yes, you're the person who needs long-term care coverage. It's really not one size fits all. You need to analyze it. AARP says you ought to consider things that seem very basic, but your age and your health and the cost of the premiums, your income, and also the type of assets you own. Many times people have part of their assets in IRAs or annuities, and if we try to do any sort of planning with Medicaid, involves giving away the assets, that can have a bad income tax result. So it all gets complicated.
Okay.
So there's no one size. So
a couple of websites you have, though?
Yes. I would go to the AARP website, which is on the screen, www.arp.org, and then the Insurance Ohio, I won't try to say that again, that website, and go to those websites to start the process to see what you can do.
All right. So whether to purchase long-term care insurance is a difficult issue. You need to talk it over with your advisors on what choice is best for you.
Call Solomon, Steiner, and Peck at 1-888-236-5173 for more information or to schedule a speaker for your organization. Or log on to www.ssnplaw.com.
Thanks for joining us. On next week's show, could a past problem be weighing you down? We'll focus on fighting fat after a life-altering issue. Then we'll celebrate the survival of women battling and beating breast cancer. We'll state the facts you need to know about your financial statements. Plus, physical activity is important to successful aging. We'll share ways to keep you moving. But until then, please remember to make the most of your golden opportunities.
If you'd like to join our kitchen conversation, visit our website, www.goldenopportunities.tv. Like us on Facebook. Call us at 440-742-GO-TV or email us at kitchen@goldenopportunities.tv. We'd love to hear from you.
Golden Opportunities is paid for by Elder Productions.